Well, hi, everyone. It's 11 o'clock Central. Happy Wednesday to you. I'm Sarah Alsager. I'm the Director of Communications and Outreach for Soy Nutrition Institute Global. Thank you so much for being with us today. Our webinar today will provide an overview of scientific evidence as well as practical guidance for interpreting published research. We'll also explore when research interpretation is out of scope and how to recognize that limitation. And our webinar today is co-sponsored by Bayer and Soy Nutrition Institute Global. We've got a great program planned, so we're so glad you're here. So just a little bit about S&I Global. We're a global scientific voice of soy for human health and nutrition. S&I Global leads the way in soy and health research, outreach and communications, and government and regulatory affairs. Our members include industry up and down the value chain, from ingredient companies to CPGs. It also includes nonprofit organizations in the soy space, including the United Soybean Board, state soybean boards, and the U.S. Soybean Export Council. And we're guided by a scientific advisory board, which provides guidance in various areas of nutrition science. All of these stakeholders work collaboratively together to advance soy.
And hello, everyone. I am Kelly Bristow, and I'm the Global Nutrition Affairs Lead for Bayer Crop Science. And I'm thrilled to be here with you all today, acting as a co-moderator to this timely and important discussion. As you can see on your screen, Bayer has 3 different areas of business. We've got pharmaceuticals, consumer health, and crop science. I sit in crop science, and that division is the world's leading agriculture enterprise with business in crop protection, seeds, and digital farming. We offer a broad portfolio of high-value seeds, improved plant traits, innovative chemical and biological crop protection products, and digital solutions, and extensive customer service for sustainable agriculture. We are thrilled to be here along with Soy Nutrition Institute having this discussion today, and I'd like to put it back to Sarah for a little bit of housekeeping before we start our webinar.
Great. Thank you so much, Kelly. So here's what we can expect today. Our webinar will be 1 hour in length. If you have questions as we go, feel free to type those into the Q&A, but we will be reserving our question answer portion of the program for the end of the webinar. A recording of today's webinar, as well as the slides that will be shared, will be available after it's over, and we will email those to you directly. Today's webinar has been approved by the Academy of Nutrition and Dietetics for 1 CPEU for dietitians. So at the close of the webinar, a survey will pop up, and we ask that you complete that survey, and then your certificate will be emailed to you within the next week. We invite you to chime in on Twitter or Instagram using the hashtag #translatingresearch. And lastly, we have a couple of questions for you to weigh in on via a poll that will pop up on your screen right now. So there's three things we'd like you to answer before we get started. The first is, how do you typically hear about new scientific research? A couple of options there, select all that may apply. The second, how would you respond to this statement? I feel confident assessing the validity and strength of scientific research. And then the third, how would you feel about this statement? I feel confident translating scientific research into consumer and client-friendly communications messages that accurately reflect that research. So wait just a moment while our participants weigh in on this poll. The answers are rolling in. Thank you so much. Okay, I think we've received the responses we're going to receive. I'm going to end this poll. Thank you. And I'll just show you these responses just so you can kind of see. It looks like news media outlets, social media are top ways that you hear about new research publications. Kind of mixed feelings on the confidence in assessing the strength and validity of research. So that's great. We're going to talk about that today. Hopefully we can get more of you to land in the strongly agree category. And then that last question looks like pretty overwhelmingly neutral about being able to translate that research. All right. And now I'm going to pass it back over to Kelly.
Thank you, Sarah. So I get the pleasure of introducing our presenters for today. First, I'm going to introduce Dr. Andrew Brown. He is an associate professor of the Department of Biostatistics at the University of Arkansas for Medical Sciences and Biostatistics, core director for the Center for Childhood Obesity Prevention with the Arkansas Children's Research Institute. He is formally trained in nutrition, biochemistry, and statistics. He has conducted research using simulation, in vitro, ex vitro, animal and human observational and interventional models. In addition, he conducts research on research through qualitative and quantitative research summaries, characterizing reporting practices that may perpetuate scientific misinformation and evaluating methodological and statistical choices that may result in ambiguous or misinterpreted results. After Andrew's presentation, we will hear from Connie Diekman, who is a former food and nutrition consultant in St. Louis, Missouri. She is the former director of the University of Nutrition at Washington University in St. Louis, and a former president of the Academy of Nutrition and Dietetics. She is the former chair of the American Heart Association Missouri affiliate, and she is also a former chair of the Weight Management Dietetic Practice Group, which is a subunit for the Academy of Nutrition and Dietetics. Diekman worked as a television nutrition reporter for close to 15 years, working for the NBC, CBS, and Fox affiliates in St. Louis, Missouri. For 15 years, Diekman was the voice of the Eating Right Minute, which aired on radio station WBBM in Chicago. So thank you, Andrew and Connie, so much for being with us today. With that said, I'm going to hand it to Andrew to get our presentations started.
Fantastic. Thank you for that introduction. It was fun to see the responses to the survey there. So yeah, today I am going to talk a little bit about understanding and interpreting scientific research, particularly the idea of reading past the headlines. And I'll show you here in a minute why that is so interesting to me in particular. But to start, I do want to show disclosures over the last 3 years. As I think was mentioned, a recording and these slides will be available. So if you want to read this closer, you're absolutely welcome to. And I'm also happy to share the slides, although I think that may also be done centrally. But the most important part on this slide is that the views are my own and do not necessarily represent the views of my employer or any other organization. The corollary of that is that if you like what I'm saying, then give some credit to my colleagues. And if you do not like what I'm saying, blame me. So what's the problem that we're going to talk about today? And it's essentially this, is that there is a lot of research and only some of it makes it in front of us in terms of headlines. You really can't read every paper that comes out about nutrition every year. There's just too many. You'd have to spend every waking hour reading every single paper. And one of the things that we do each week is this headline versus study in the obesity and energetics offerings that we send out. And here's an example from a few years ago now that is still just one of my favorites. So in the same week, one of the headlines says, "Cheers science, red wine fights obesity and keeps you slim," when the study was actually resveratrol, which is a compound in red wine, induces something known as beige adipogenesis, and it happened in mice. So first of all, not red wine. The amount of resveratrol you would have to consume through red wine, you would destroy your liver first. And it's not obesity, it's beige adipogenesis. And unless you are a mouse, this doesn't necessarily apply to you. But then for another headline that same week, research, drinking alcohol sparks eating leads to weight gain. When the study was actually alcohol's effects on the brain response to food aromas in women, no drinking and no weight were measured. So you say, wait, no drinking? Yes, this study, they injected ethanol into the veins to see what happened from just the blood alcohol level, as opposed to the actual full social experience of having, a drink before dinner. So in the same week, red wine is potentially curing your obesity as long as apparently it's non-alcoholic red wine injected into your veins. I don't know. So we just get so much. And how do you parse these things apart? Well, then we also have, studies where the same data set keeps being used repeatedly. That's not necessarily a bad thing, but in just October of last year, we see this headline about coffee lowers risk of heart problems and early death, especially ground and caffeinated coffee. The press release also says coffee drinking is associated with increased longevity. So look at the difference in language. Up here, it's this causal language about heart problems and early death. Here, it's a very statistical comment about coffee drinking and associations with longevity. And the study, though, was self-reported coffee consumption in this UK biobank study, which is a huge sample. And again, so why do I put again here? Well, that's because just the prior year, there were 3 studies, at least in the same week. Maybe that's 4 studies in the same week looking at associations between self-reported coffee consumption and all of these different outcomes. So we just keep getting inundated with these types of things where the headlines often will go a little bit further than what the science can actually support. But this isn't a new problem. Sometimes we wring our hands about how, the communication's worse today. Well, here's an example from my wife's great-grandmother's scrapbook about coffee drinkers are the best workers tests show. And it starts with coffee has been tried and acquitted. It's been put under all these chemical tests, etc. Well, I got interested in this, so I decided to hunt it down. And this is the scientific article that's associated with it from April of 1924 in Popular Science Monthly. There is more space given to this adorable picture of these researchers feeding a rabbit on the floor of the laboratory, which at least today would not be appropriate animal care and use. But this is it. This is the entire article about, and most of this matches that. That's it. That's all we have for this scientific understanding of coffee here. But in that same edition of Popular Science Monthly, 10 reasons why your head aches, overstimulation, drink less coffee, and cut down on your smoking. So apparently coffee will give you headaches, but it makes you the best worker. So this isn't a new thing. We've been here, we've been doing this for a long time. Understanding and communicating science, particularly in popular press, is a difficult thing. So what do I look for then? So what is it that will make me see a headline and go, I bet that's going to be a good headline versus study? Well, I start from considering what the science is. And for the science, I often look at this PICOTS or PICO model for clinical questions. And this is this evidence-based medicine type of approach where you're trying to figure out how the science fits in to the question you're actually interested in. So the P is the patient population or problem. I is either the intervention or the predictive factor or exposure. The C is comparison or control. The outcome is what is measured. The T is what type of question are you asking or over what time period. And the S is either the study design or the setting. So if you're interested in the effects of a food on people, but then you do your study on rabbits fed beans compared to we don't know what in a laboratory over a short period of time, your PICOS models aren't necessarily lining up as well as you would like. So what does a PICO statement look like? The general structure that some people can use is in population is intervention better than control for outcome. So what does that look like? In children, so the population is eating breakfast an intervention or an exposure at home. So eating breakfast at home in this case would be the entire thing that you're interested in, better than the control or the comparison group. So better than at school. And then what might the outcome be for behavioral and psychosocial outcomes? So this is if you're able to turn a headline into a question like this, depending on what the design of the study is, you're able to really kind of tease it apart and evaluate whether or not the headline and the study are answering the question that you think they might be. I talked about type of study, and I like to think of kind of three general purposes of research. One of them is just describing how things are. And so in this case, keeping on the breakfast theme, you can just say X% of children skip breakfast. You're describing it. You're not saying why, you're not saying what the effect is, you're just saying X% of children skip breakfast. One is kind of prediction or prognostic or diagnostic, which is you're wanting to know if you can determine who might have an outcome or who might have a behavior or who might have a disease. And so that might be something like people who skip breakfast are more likely to have obesity. That's not saying that skipping breakfast necessarily causes it, but if you know whether or not somebody is skipping breakfast, can you better predict whether they have or will develop obesity? So that's the prediction. The other is explanation, which is a lot more of causation. So providing reasons in terms of causal relationships like testing. Does skipping breakfast cause obesity? So these are different questions that often don't get answered by the same study or study design very well. And so we're going to put all this together with an example or two coming up. But first, I wanted to touch on what some of you may have seen before, which is an idea of this hierarchy of evidence. And often people just say a hierarchy of evidence, but I want to emphasize this is a hierarchy of causal evidence. And the reason why I bring up causal is if we start at the top, you can have observational or experimental meta-analyses and systematic reviews, randomized controlled trials or uncontrolled trials where the experimenters actually implement an intervention or a policy and then test the effects. That's an experimental study. And then you have these observational studies where people are followed up or asked questions or observed, but nobody is actively intervening on them. And so you'll have cohorts, case control, cross-sectional studies, and then you can have animal trials and in vitro studies as well. And then case reports, opinion papers, and letters are still here because people's ideas, I think, are still important to consider, but it's not exactly the strongest evidence to say, I saw one person, and so we should do this to all people. So why do I bring up the causal evidence? Well, it's because if you're wanting to do prediction, often that's going to be more from the observation as opposed to doing an experiment. Or if you're wanting to know the proportion of people with a particular disorder or something, you want a representative sample of people, and those experiments aren't usually going to give you that. So you have to match the design to the actual purpose that you're trying to answer. I also want to bring back that it always depends on the quality of the study. There are some fantastic observational studies and some absolutely terrible randomized trials and vice versa. And it also depends on comparing the same PCOS elements. And that's the big problem, that often what you'll have on a good observational study, particularly in nutrition, is you have a pretty awful estimate of exposure. We ask people how much they eat. And there is a vast amount of literature describing how problematic that is for determining actual amounts of consumption. But for some of these big cohorts, you actually get the outcome of interest: heart disease, deaths from different causes, incident disease. And so that you have a really good estimate of the outcome. But then you'll have some experimental studies where you have fantastic characterization of the exposure. You know what you're giving the people, you're characterizing it, you're following them up, you know that you're giving that to them. There's not the selection bias, but then you're looking at like blood cholesterol and using that as a proxy for heart disease. So fantastic exposure, good causal design, but not the outcome you necessarily want. So that puts us in a bit of a conundrum, particularly for nutrition research, where it's over long periods of time that diet-related diseases develop. So the challenge is comparing the PCOS elements. For that matter, that's where some animal studies are actually fantastic. You can't do a study over the course of a whole human lifespan very well. but you can see how long rodents live or other animals live under different conditions. And so you can get really good evidence, good exposure, good outcome, good causal design, control for problems. The only problem is it's not in humans. So you have to make that big leap from the animals to the humans. So that's the reason why all of this needs to come together. And the hierarchy isn't meant to be dismissive necessarily. It's just to put things into context. And of course, this is probably a dated list now. Somebody was bringing up, maybe TikTok should be in here. I don't even think Instagram's in here, other things. So, just opinions, general opinions are not necessarily a great source of causal evidence. So one other thing that I'll bring up briefly, there's lots of different people who thought over time about how to evaluate the strength of causal evidence. And one of the most used is the Hill criteria. And this is looking at a variety of things that when put together, even in observational epidemiological research, makes it a lot more likely that you've got a causal factor there. And one is the strength or the effect size. So if you've got just this tiny little difference between groups, lots of things could explain that away. And the classic example is smoking, where the difference was so huge, it's very difficult to say that it was just confounded by something else. Consistency, do you see it over and over? Specificity, no or few other explanations could explain the phenomenon. Temporality, at least the way that we understand the time continuum, the effect needs to happen after the cause. So you need to make sure that you're measuring the cause and then the effect. Biological gradient, so the more of an exposure, are you seeing more of outcome? In nutrition, it can be problematic because there's a lot of U-shaped curves where you have too little of a micronutrient and you've got health problems, and too much you've got health problems, but that's still a gradient. It just isn't necessarily a straight line. Does it make sense? Is it plausible? Do different lines of evidence converge? Can you actually test through an experiment? And then are other known causes, effects, or associations similar? So how do we apply all that? So that's what all runs through my head when I read a headline. And so I recognize that's a lot. So let me just walk through one example. And I do want to point out one thing. I'm going to show some examples. I showed some other headlines. I showed some studies. And there's this quotation from Eleanor Roosevelt that's something like, great minds talk about ideas, average minds talk about events, small minds talk about people. So I'm not talking about authors here, and I'm not talking about the researchers here. I'm using these as examples to have a conversation about the disconnect between the two. So that's the reason why you don't even see authors on the list. I'm not talking about the people. I want to talk about the idea. But when I saw this headline, so we've been doing some work with breakfast skipping and eating and obesity for a long time. And so I saw this and I see mom and dad were right. New study shows just how important breakfast really is. It turns out where kids eat breakfast matters a whole lot too. In a study we did about a decade ago now, we found, about 100 papers that were looking at this question, asking children or their parents where kids, ate, or adults where they ate, and estimates of obesity. So, when I see this headline indicating they finally figured it out, I'm interested. But what do I look at? So first I see eggs and toast. I don't know, that must be a section or something they were doing. Clever. Mom and dad were right. I assume that's just headline fluff. I don't know that, there was anything about moms and dads in the study and how right they were. It says a study, so I presume this is about a new study that's empirical research. When they say how important breakfast really is, that's implying causation, that breakfast is important because it'll cause a difference in outcome. So the exposure is breakfast in this case. Where kids eat is another exposure. The fact that it's in kids, I see population. Another, that it's eating breakfast. So where and eating breakfast, again, matters. Causation, that they're saying whole lot. So I'm expecting a big effect size, but they don't say for what. There's no outcome here. So when we look at the actual study, it's breakfast and psychosocial behavioral problems in young population, the role of status, place, and habits. Well, this was a cross-sectional Spanish cohort of 4 to 14 years of age. the breakfast habits. The question was, what does your child usually eat for breakfast? And here were the options: coffee, milk, tea, chocolate, cocoa, yogurt, etc. Bread, toast, cookies, pastries, etc. Fruit and or juice, eggs, cheese, ham, etc. and other foods. This etc. is actually part of the question. And typically you don't want to use etc. in scientific research because you don't know what else that includes. Another one was breakfast place. Where does your child usually eat? There was a strengths and difficulties questionnaire. So the outcome was a questionnaire and the setting was a free living national cohort and cross-sectional. So when I looked at the actual study, the first question that came to mind was, does it matter what the results of the study are? So I didn't show you what the results were because I think it's important to first consider if the results went one way, would it change your mind? Like, is this going to compel you? That's not necessarily saying the study is bad or shouldn't have been done, but does it matter for you? Does it matter what the results were either way? Is it going to change your mind if it disagreed with what you believe? The strength of this study, if you look at that hierarchy, self-report, cross-sectional, not really the strongest for that. The reason why it caught my attention, though, was when you look at the actual Fatherly article, it says, until the U.S. takes significant steps to solve child hunger, children will continue to rely on school meals that, according to the researchers, are detrimental to their mental health. So now we've got a statement criticizing school breakfast meals for parents that are already stressed out that actually conflicts itself. The U.S. is taking significant steps to solve child hunger through school meals. So that was odd. And so we could critique the lay author, but when we look at the scientists kind of doubled down and really overstated the strength of the results compared to the scientific paper. So it's hard to criticize the news article author when the scientist is overstating. So the other thing, again, just to talk about in mice, this one wasn't in mice, but people have made that point in other headlines as well. So here's from Nature: a study in Nature shows important differences between the male and female immune system, which may explain why men are more susceptible to obesity. This Twitter account, just anytime there's an article, just literally puts in mice. Not saying it's a bad study, but it's important to remember that context. So what can we do? Well, I really appreciated this perspective, which this author was expressing, struggling with a paper that somebody had asked him about, and postulated, what does one do when one has to read a paper that is outside of his or her knowledge base? One solution could be to just stop reading the paper and go do something else. And I think that's a good message insofar as we don't have to understand every paper. We don't have to understand everything, consider whether or not that one matters. And that is an important point of this webinar as well, as he does go on to say, unfortunately, the paper was not easy to understand, but if you are asked about a paper, then you've got to do something besides go do something else. So go back to the original paper and look at it to see what the design was, rather than just relying on the headline. Remain skeptical, but not too skeptical. I like this paper by Allison Pavella and Aransky about reasonable versus unreasonable doubt. So think about the study design, what was actually done. Could it describe, predict, or explain? What is the total body of evidence? And also consider whether you would change your mind or your recommendations if the results came out the other way. Because if a paper won't change your mind, then you probably should just spend your time doing something else. But if you're open to having your mind changed, then maybe it's worth engaging with that paper. Again, if you find the article to be containing misinformation, sometimes do nothing. And we'll talk about this coming up. Determine whether or not it's worth trying to correct information that is wrong. And so we'll give some examples of this coming up. And finally, it's important to think of two very different discussions. And one is the idea of being persuaded, and the other one is proof. So one is behavior that is taking in all kinds of personal considerations or policy imperatives. The other one is whether or not you would expect to see a change or a difference or an improvement. You can think of that as making decisions, what should we do, versus making conclusions, what will happen if we do it. should versus science. So, let's say you found a study that showed eating cardboard every day was the most effective for weight loss. Should you do it? Yeah, it's a decision. Science can't answer whether you should, but it can tell you what you can expect to happen if you do something. And being able to separate those two conversations are very important. So thank you very much. At this point, I'm going to go ahead and turn it over to the next speaker, Connie Diekman. And Sarah, I believe you've got control and handed that over.
Yes, should be with you, Connie.
Fantastic.
All righty. Well, thank you, Andrew, Sarah, Kelly, and welcome and thanks to everybody who's joining us. So I'm going to take this into, where do we go as it relates to our responsibility in terms of critically thinking through everything Andrew just presented. And then how do we have to do what we do within the framework of our code of ethics? As Andrew said, I've got my disclosures listed there as well. So let's jump in and look at this critical thinking piece. We all hear this and excuse me, many of you on here have probably looked up this definition many times, but I think it's always important to start with this because sometimes I think we hear critical thinking and we assume that we all do this. What is important, I gave you two different definitions here, one really short and one a lot longer, but what's important here is you look at this, is critical thinking improves the quality of your thinking. So it's not just the 1 is 2 is 3 is 4, it's the depth. Some of what Andrew went through in terms of really doing assessment. It's almost like we could take that critical thinking and change it and say critical assessment. In terms of how this translates to our practice, and obviously time is always an issue, but critical thinking, as we all hopefully know, is an essential part of evidence-based practice. In 2019, the Academy actually had a declaration as it relates to what we should be doing with regards to critical thinking and evidence-based practice. And you can see the definitions of critical practice or critical thinking, on here in the words that I've highlighted: asking questions, systematically finding evidence, assessing validity. As you just heard, single study, multiple studies, animal study, human study. Importance to practice. How does this translate to what you need to take to your practice situation? And then, of course, the essential component, and it's kind of a shame it sits down at the bottom, but is how does this impact what's important to our clients? Remember, that's what comes first. What's important to our client, and then our responsibility part is sitting in the top part of this definition. So the evidence-based practice piece really speaks to evidence is the grounding for what we do. And I use the word practice, and as you look at it, as you look at practice, it doesn't have to be in a setting. Practice could be what you're doing on social media. Practice could be what we're doing here today in a webinar. It doesn't have to be that client relationship. So when you look at this issue of critical thinking and, how do you move that? And you heard a lot of this from Andrew, but the big one, and he said it in a little bit different words, but just because evidence that might contradict what you believe doesn't mean you should be avoiding that evidence. So if there's something different, that's when we need to go back to that assessment, look for the research, really think through. Just because we've learned something that's grounded in evidence and science doesn't mean it's going to stay that way forever. And then, of course, what's important about that is that we reflect on what we know, what we believe, what we learned, and decide, how do we need to change? What does this new evidence add to the way in which I practice or to the way in which I communicate? Because it's changing something that I've long communicated. And of course, because science is, and I said these words the other day, and Andrew's correct. Science is constantly changing, but sadly, it's not always changing. But because there is always something new, remember, just because there isn't a body of evidence yet, don't make an assumption that a new study is correct, or it's safe, or it's how you should switch what you do. It might be that it needs to be integrated with a caveat, but just remember, Just because no evidence exists doesn't mean it's safe or true. Critical thinking means really looking for what is the evidence show me. And if you pull it together as 3 key points, I like these 3 because it makes it easy to remember them. Strength of the evidence, make appropriate inferences from the facts and know the trade-offs. If your client says X and you're pretty sure that that's not correct, how are you going to communicate that so that the client still feels connected to you and not put down by you? And then remember to keep your emotions in check. It's so easy for all of us to pull in, well, I believe, I think, I heard, I do. But remember, our evidence-based practice comes first. We can certainly say, my analysis of that study comes up with a different outcome, but make sure you disclose it like that you don't just jump right to, no, I don't believe that, because that's not how we're to practice, which transitions us into the issue of ethics and how our code of ethics plays a role and where critical thinking sits in that. And I think, as we all know, especially since we have to do the ethics credits as a part of our credentialing, dietetics is based in ethics, and some of the key points there, and again, there's that science is evolving. Yeah, it's evolving. I mean, look at it. We talked about back when I started practice, saturated fats, bad. Then they got good. Now they're bad again. So sometimes it's the same communication, but it's still evolving. It's changing. This causes confusion. In today's world, social media, which we noticed on the poll, many of us use as where we stay on top of things. You can find any answer you want, and consumers can get the answers they're looking for in a variety of places, which leads to their confusion. And so they want to take back that control, and they want to decide what's important for me. That's where our code says we must effectively, accurately, and compassionately share that evidence. Because again, a client has a belief or a perception. We shouldn't be there to put them down. We're there to help them learn and change based upon what our knowledge brings to the table. I don't know if everybody's aware of the fact that the International Confederation of Dietetic Associations actually has a code of ethics, and all dietetic associations belong to the International Confederation, and all of them utilize the code of ethics from ICDA as the foundation for their individual codes. So as you can see here, back in 2010, the last time that ICDA looked at the code, there were key principles there. We should practice by being competent and objective, respecting all people and their needs, collaborating with others, striving for positive outcomes for the people we work with. That's why we do what we do no harm, and then adhere to those standards of good practice. The Academy's code, again, is built upon that. And when you look at the Academy's code, what it provides us, yes, it provides us a lot of detail, but it provides us with guidance for practice. It is that overarching, here's how we should do. And in that, it reflects the values and the principles that guide what we do and tie back to the other code. It gives us indications about our obligations and our commitments to the public, to the profession, to each other, and to other professionals. So it really helps us understand how to work as a part of and not separate from the collaborative efforts of helping our clients. And then it does that definition of services where the science base derived from the best available research. That's what ethical practice is about. Excuse me. All right. So just a quick, well, what does this mean in practical purposes? Just an example that I pulled so that we could pull it to the code of ethics. You can read it there on the screen. I'm not going to go into it, but the highlighted part is what I want you to pay attention to. When we talked on World Obesity Day, there was a tweet that indicated there was no evidence that higher weight causes health problems. And while it does go on to say that weight stigma and weight cycling are a problem, and yes, in fact, they are, and we all need to acknowledge that, there is a body of evidence, of course, that indicates obesity does put people at an increased health risk. So when you look at the code of ethics, what we see here is we should, in all places, so that means social media as well, practice based upon the evidence, make decisions that are evidence-based. So we need to communicate based upon the evidence. The tweet could have phrased a little differently to tie to that. And then we want to be sure we don't communicate anything false or fraudulent or deceptive. We don't want to mislead people. We don't want people to think that, oh, maybe it is okay, because we do have evidence, and that's what's important. Remember, it is about the evidence. That's our responsibility. The Code of Ethics of the Academy applies to all RDNs and NDTRs, whether you are an Academy member or not. If you carry either one of those credentials, the Code of Ethics should drive how you practice. And that means we need to know the evidence, present reliable scientific information without bias, or if you're going to provide any sort of potential bias, conflict of interest, opinion, you must declare it up front so that the individual knows that was your statement. Here's the science. Now I make my judgment. Because it is about the clients making their choices. It is their lives, not ours. And then you can see the conflict of interest bullet listed there, as well as the fact that, again, if you're communicating opinions or beliefs, and some clients want us to do that, that's why they come to us. Make sure you make it very clear. Here's my opinion. Here's what the science says. Now let's talk about what you want to do. That's when we become effective partners. Just recently, a couple colleagues and I, we published this paper in Journal of Nutrition. So obviously I'm declaring a little bit of a conflict interest right here, but I think it's a helpful paper as it relates to mis and disinformation, as it relates to how we deal with practice. And what you'll find in it, besides the paper, is we have 3 charts or figures that we designed to be the kind of thing that you could print out, put in your office as that reminder. As this one says, it's a checklist. You can see that on the left, those are the points we looked at on an earlier slide, the critical thinking slide. But then we provided on the right side a little bit of an extension in terms of, all right, keep emotions in check, remain objective. Don't forget that. They came to us for our expertise and yes, to be a partner, but make sure they know when we're being that partner, when we're sharing the body of evidence, ask permission to share all of those components. So where do we go from here? And Andrew hit a lot of this, so I'll move through it very quickly. He said a skeptical eye. I'll say read headlines with a critical or cynical eye. Make sure you search that study. Don't just read the headline, as he demonstrated very nicely, and look for all the components as he talked about in PICOS, or as you look here. And then look at the study and the body of evidence. One study does not make a conclusion. And always question misleading reports. Be the positive voice for our clients. Question, well, I thought the evidence indicated X, Y, or Z. Can you explain? So to summarize what this means in terms of our ethical responsibility, we help people, whether one-on-one or in the bigger communication world, to make decisions for their food choices, for their health. And that means we need to educate and translate the science. We need to share statements and guidelines and claims that are grounded in facts and avoid any potential personal bias or beliefs. And make sure you declare it if you do it. And know when to say, I don't know. That's not in my area. Let me refer you to somebody else. There's nothing wrong with that. And it's 100% perfect because your client now knows you really care about them. And then make sure what you're sharing enhances the public's trust in the profession. Because remember, everything we do individually affects all of us because we all carry the RD or the RDN credential. So it's extremely important that we remember that piece as we move forward. So thanks for my time, and I think I'm throwing it back to Kelly.
Thank you so much, Connie and Andrew. I know I've got lots of questions and thinking a lot about what you both said. I do want to flip now to do a little bit of practical application. So during Andrew's presentation, he briefly mentioned a new guide that was put out by the National Academies of Science, Engineering, and Medicine for countering misinformation. So I want to put it back to Andrew to talk a little bit more about this guide, and then we're going to work with you all to actually work through some examples. So over to you, Andrew.
Yeah, thank you. So this is, if you notice at the top, we removed the sometimes do nothing for this because we want to look at whether or not we should do something. So this is the scientist's guide for countering misinformation, but I think it applies to everybody pretty well. And there's kind of 4 steps to this: evaluate, identify, define, and communicate. And this is actually just step 1, which is the evaluation component. So if you hear a claim, you want to consider first, could the claim cause significant harm or damage to public health, national security, or other social systems, either directly or indirectly through influencing individual behaviors? So I think in the context of nutrition, is this, nutrition advice going to hurt people? We certainly heard plenty of it at the height of the pandemic. And then consideration 2, can scientific knowledge or analysis counter a particular claim? And so this has to do with, is this even something answerable through objective methods, for instance? The consideration 3 here is, does scientific knowledge or data exist to provide accurate and defensible scientific information to counter a particular claim? And the consideration 4 is, could addressing a particular claim amplify it, resulting in greater than reduced harm? So there's some examples. I think the NyQuil chicken, maybe you heard of that, where people were cooking, there was a rumor people were cooking their chicken in NyQuil. And so there was a statement that went out to kind of counter it. I don't think most people had heard of it until that went out. And so here's this message that got amplified by trying to get people to stop something they might not have even been aware of. So those are 4 considerations in just the evaluate phase, and then determining what you should do from there, another set of steps. I think that's an important place to start when we evaluate evidence. And I believe there's the survey for a headline. So I think I turn it back over now.
Thank you, Andrew. Thank you, Andrew, for that little bit of an overview. So on your screen now, you'll see that we're going to try and put this into a little bit of practice. And Sarah is sharing a poll for you all to answer right now how you would maybe use this NAS guide for practical application. In the interest of time, while you're walking through these questions and you will see the answers in real time, we are going to have our panelists actually talk about how they would assess an article like this as well. So clearly we've covered a lot today, and these topics are really important for pretty much so any food organization, including soy. But since the Soy Nutrition Institute and the Soy Checkoff is co-sponsoring today's webinar, we really wanted to take a few minutes to apply this guide specifically to a article that is related to soy. So while you're answering those questions, I am going to actually ask Connie from her practitioner perspective to walk through a little bit how she would assess an article. And then we're going to have Andrew do the same coming from his research background, because the conclusion will be the same, but in different practices and in different areas, you might approach it differently. So Connie, with that, I'd like to have you walk through your ideas a little bit.
Sure. Thanks, Kelly. Well, I look at the headline as hooks, as triggers. That's what causes people to jump in. So I look at this and I see that, are they really so bad? So immediately I say, oh, this could be harmful. I need to read this article, but I need to look for the science first. That would be my jump in piece. I'd go in there and look for, what does the science have to say? Does it align with the body of evidence? One of the things that I will always do, and I provide a lot of input to media as it relates to interpreting studies so that they can communicate them more appropriately, is I'll go look at that study, as Andrew referenced. Go look at the study, not the abstract. Go look at the study and make sure that the body of evidence is there. In terms of the 4th question on the NAS poll that we just posed, what's the that's a hard word, potential for amplification? That headline is perfect. It is a real, they did put the word so in there, so that tempers it a little bit, but having done media for a lot of years, this would be exactly what would cause people to watch, to listen, to read. So yes, it has tremendous potential for amplification. Andrew?
Yeah, this is, so when I actually first saw some of these headlines coming back up about seed oils and oil saturation, I was like, oh, are we back on this again? And that's because there's really nothing new under the sun. I started actually as a lipid chemist in my past research life. So when I saw this, I was like, didn't we go through this already? Is there really that much new knowledge? And so that was the first thing I thought of. And I also heard in my head, somebody when I was early in my career, I got really worried about, this book that came out about, weight loss and how, it was giving all this terrible advice and that people were worried. And the individual had been around the block a while, looked at me and said, if people are actually worried about a book, they haven't been in the field long enough because, again, everything goes through again. So could this conversation, not this headline or even the sub piece there, it's not the all-time most nutritious option, but there's no reason to freak out about seed oils unless you're in the camp that these are very toxic, acutely and chronically toxic things. I don't see a overarching middle moderation type headline being a cause of significant harm. Can scientific knowledge or analysis counter any of the claims either in the headline or the article? Well, it depends on what they mean by nutritious. How do you quantify freak out? And for that matter, what do they mean by seed oils? Because I found a whole bunch of things that are not seed oils are being included in the conversation about seed oils. But yes, scientific knowledge could support or counter anything in this potentially, depending on their definitions. Does scientific knowledge or data exist to provide accurate and defensible scientific information? I would say to some extent, despite this being studied for so many years, there's still a lot of disagreement, even in the scientific disciplines of how much, what ratio, proportions, and also just the history of the unsaturated oils being a source of trans fats back, when everything was partially hydrogenated. So there's a lot of new evidence that could exist, but lots of discussions to have. Could addressing it amplify it, resulting in greater rather than reduced harm? Potentially, depending on what people go to replace. And we saw that happen with the low-fat craze where everything was reformulated based on people's preferences trying to avoid things. But I think here, the way that they're trying to address this question, there's not much amplification here because it is straightforward. It's not freaking out. And so people probably aren't going to amplify boring but accurate messages about moderation and nutrition, which unfortunately is what we have a lot of in nutrition. Boring advice of moderation is usually pretty good.
I think though, Andrew, the only thing is that very few consumers will read the second line. All they see is, oh my gosh, are they bad? Sad statement.
Yeah.
And, we seeing that, I think you highlighted the really so bad for you is hooking people who are asking this question. So they're trying to pull people in that have not made up their minds yet. So it's a good way to amplify a message by getting those people in. And then the question is, when you really open the article, what is the evidence? And that's really kind of the next step. You're right. People are going to stop at the headline.
Yep. I know. What is it? We've got 7 seconds of attention span anymore, which I know we're all too familiar with, especially in the world of TikTok. And so we do have a couple of questions that have come in. I do want to respect everyone's time. We've got about 5 minutes remaining. The first one I'm actually going to put to Andrew, and it says, isn't correlation, not causation, the relationship consistently found in research on obesity and all of the diseases obesity is claimed to cause and exacerbate?
Obesity is actually, so we actually have a short course on causal inference and behavioral obesity research because it is such a tough topic. And there's a figure, which is, you think about cause and effect, right? Well, how do you, if you're saying obesity causes an outcome, how do you change obesity? And it's not that you just go into somebody and change obesity, right? You change obesity through diet, exercise, surgery, smoking. And so those are very difficult things to evaluate. And so that is one of the points of contention, and the difficult topics is, what does it mean for obesity to cause something? And so, and that's the reason why I absolutely loved the example of problems with weight stigma and weight cycling. Weight cycling is a little bit, I think, murkier for, whether it's problematic. I think it depends on a lot of factors. But weight stigma, I think people are pretty confident causes problems. But it seems, with the exception of smoking, pretty much any other way that people address obesity, and by obesity, I don't just mean weight. I mean, accumulation of adipose tissue and ectopic lipid accumulation that affects metabolism, not just body weight. So we have to be specific about that. But whether it's medications or surgery or basically anything but tobacco, for the most part, you see improvements in health outcomes. And so when you put those things together across different models, that's the reason why there's a lot more of support for the idea that obesity is causing the outcomes. Then you can, that's the nerd answer. The next part is, right, the practical applications. And that's where targeting weight is, I think people are moving away from that. They're interested in targeting metabolism. So you can improve diet, improve activity, improve everything that, all those metabolic, outcomes. Is that treating obesity? Can you even skip the discussion about obesity and still do all those things to improve health? Potentially. And so putting it into that broader context is also a bit of a challenge as well.
Thank you, Andrew, for that detailed response. We've got one more question that I think we can squeeze in from the audience, and we'll try and get to any extra questions that we didn't have time to get to. And then I have one question I want to leave both of you with, just to kind of bring it back together. So one of the participants had said that they often or sometimes use examine.com. Do you have any thoughts on that site or any reference to that as being a good site?
I don't use it, but I know I'm lucky in that I have access to the WashU Med School library, so I go immediately there. So I'll let Andrew answer if he knows anything of that site.
Yeah, I think the idea of going back to the original papers is always important. And so much like, yeah, it's kind of a trust but verify. So I think I do recall seeing some good things on that site, but I don't categorically in my head have it as a good or a bad. I just haven't thought of it that way. But anytime I find myself really agreeing with something, I often try to stop and go, okay, can I convince myself otherwise? So if you're liking everything in it, maybe also find, see if there's a good point for a counterpoint.
Just very quickly, Kelly, I would remind all the RDs and DTRs that, many of our practice groups provide updates on research. The Academy Evidence Analysis Library also provides some of that. And, I think the other thing is, again, looking at what the universities in your area might provide so that you can get to the studies as opposed to just abstracts.
Connie, I think that's a great addition, because one other comment/question was that access to research for clinician is quite difficult. That can be paid access only. So I think those practical tips of how we can access some of the paid only articles is really helpful. So thank you for that addition. Before we close out, just quickly, from each of you, what is your one good way or multiple ways to stay on top of good research? If you had one parting word for today, do you have a place that you would direct everyone? Because it's not
really, that's a really hard question for 1 minute, Kelly. I go to many places, so I don't have a one. I mean, yes, I go to the med school library and I look there. I go to PubMed. If it is something that I can't get through the WashU library, I will contact colleagues to see if others can get it. And I think that's collaboration that we should all support each other on.
Thank you.
I'll say with regard to access, that is something that is changing through regulation. Data availability has just changed at the NIH. There's a Plan S overseas, this to make things more available, and anything NIH funded already has to be in PubMed Central. So that's being addressed. I think it depends on what you're trying to do with the information. So if you're just wanting to get new studies, you can go into PubMed. You can create something that'll send you new articles every week on a topic that matters to you. If it's trying to get in front of things that your clients or patients or that you yourself are interested in, I'll get different smart briefs and journal updates and things like that. And I try to look at the things that either I am anticipating people talking about more that I need to be on top of, or that just interest me. But there's too much research to be able to keep on top of all of it. So really targeting what you're interested in is important. And I'll put a shameless plug in for the obesity and energetics offerings we put out every week, where we find 100-ish articles that seem interesting. Some are better than others, but we share that every week as well.
Thank you for
No,
saying
I think
that.
that's
Yeah.
great. Love all
Kelly,
of these ideas. Oh, go ahead, Connie.
just very
please.
quickly, I did put this in the Q&A, and I don't know if everybody looked at it though. The Journal of Nutrition article is open access, and I do have to say that is thanks to Bayer. Bayer is adamant about any of their research being available to anyone who wants to see it. So we really appreciated that they took care of paying for the cost to have an open access article. So if people need it, please go check it out.
Yeah, no, thank you both for those insights. And I think to sum it up, it's really complex. And as many are saying in the chat and in the Q&A, it's extremely time consuming. And so Andrew, I think you had said, and Connie, like collaboration and, where can you collaborate on some of these items that are needed as well. So we are over time. So I do want to wrap up by just saying, thank you so much for coming today and for spending an hour with us. I think this is a topic that we could well spend half a day on, but we do appreciate your time. And I do want to flip it back over to Sarah to come back and do a little bit of housekeeping before we close out.
Yeah, just a few important reminders. So right after the webinar closes, you'll be invited to take a quick survey, 3 minutes of your time. We'd really appreciate it. And then that CPEU certificate will be emailed to you next week. And if what you heard today was beneficial to you, you can follow along with Soy Nutrition Institute Global and Bayer. We talk about scientific research all the time. So that concludes today's session. Thank you again for joining us, and have a wonderful rest of your day.